Good afternoon, everyone. Welcome to the Healthy Pennsylvania Press Conference. Thank you so much to my colleagues that are here on this busy session day, but that just shows the importance of these issues. I'm State Representative Natalie Mihalek of the 40th Legislative District. I want to start off by thanking my partner in this endeavor, Representative Melissa Schustman, for her passion and advocacy on these issues. I also want to express my sincere gratitude to the nearly 40 bipartisan co-sponsors of the various bills in this package. That kind of rare bipartisan showing speaks volumes to the importance of these issues and the urgency to create solutions. We are facing a public health crisis, a crisis that stems from how we are nourishing ourselves. We are drowning in toxic abundance. Healthy PA aims to proactively safeguard public health. These legislative efforts reflect a commitment to addressing multifaceted aspects of public health and safety. By promoting transparency, accountability, and community well-being, this package serves as a model for how state-level initiatives can enhance and complement federal regulations. Today, more than 60% of the standard American diet is made up of ultra-processed foods, which bear little resemblance to any actual food at all. They're cheap, they're abundant, they dominate our diets and the aisles of the grocery stores. They are marketed to our children and engineered for hyper-palatability. When a certain potato chip brand says, "Bet you can't just eat one," they know that you literally cannot, because teams of scientists figured out a way to get us addicted. Ultra-processed foods, which are the subject of House Bill 1132, are chemically engineered and nutritionally hollow, designed not to nourish, but to addict. Ultra-processed foods are aggressively marketed, deceptively labeled, and scientifically linked to rising rates of obesity, diabetes, cardiovascular disease, decreasing fertility rates, rising cancer rates, and chronic illnesses plaguing younger and younger Americans. Every corner of our healthcare system is affected by these diseases traced back to poor nutrition. Ultra-processed foods are laden with artificial dyes, industrial preservatives, and synthetic flavor enhancers such as BHA, or butylated hydroxyanisole, which is the subject of House Bill 1133. BHA is a synthetic antioxidant used to extend shelf life, and since 1991 has been classified as reasonably anticipated to be a human carcinogen. It is also a known endocrine disruptor, with additional studies finding that it can harm the reproductive system, wreak havoc on the liver and lungs, and cause cancer. A petition was filed with the FDA in 1990 to ban BHA, and the FDA invited the public to comment on the petition later that year. At the request of industry, the FDA extended the public comment period 64 times, resulting in nearly 35 years of inaction. This story is not unique to BHA. Nearly 99% of food chemicals introduced to our food supply since the year 2000 have not been reviewed by the FDA. Rather, they came to market through a gaping hole in the law called the GRAS, or Generally Recognized as Safe, loophole, and is the subject of House Bill 1130. A food additive petition triggers a rigorous pre-market safety review of a chemical, which can only be used after FDA approval. That's why no one is doing it. I have a graph here that shows how many chemicals have actually gone through the rigorous pre-approval process. And as you can see, it's very little. In fact, in the last decade, only one food additive petition for a new chemical has been filed. 756 new chemicals were added through the GRAS loophole, which means when a company wants to introduce a new chemical through GRAS, they can notify the FDA that they are doing so on a completely voluntary basis. Just a voluntary notice, hey, we're doing this thing that the scientists we paid said was okay, and we don't even have to really tell you that we're doing it. We must demand scrutiny beyond industry assurances. This entanglement of corporate interests and scientific research has eroded public trust, and that is evidenced in the testimony we heard just this morning on the safety of artificial food dyes, which are the subject of House Bills 1131 and 1134. There is zero nutritional value to artificial food dyes. They are used for aesthetic purposes only. They are found in everything from cereal to sports drinks to snacks to infant ibuprofen. Many not found in foods in dozens of other countries, And even the ones that do have them, they require a warning label. Food dyes have certainly made headlines this past year as the FDA, after 35 years, banned Red 3, and promises have been made at the federal level to scrutinize other artificial dyes. Make no mistake, there is absolutely no mandate whatsoever from the federal government right now to eliminate dyes. There is a promise to work with industry, and that is it. And that is why state action, like these bills, is so important. Countless independent studies have linked artificial dyes to hyperactivity in children, behavioral issues, damage to DNA, which raises cancer risks, just to name a few. We heard this morning from industry that dyes are unequivocally safe as determined by safety data, which was funded or conducted by the colorant industry itself and ignores a substantial body of independent research. The dual role of seller and scientist creates a massive conflict of interest and undermines public confidence. Why must we wait around for decades to take action? Why are the companies that profit from using inferior ingredients the ones telling us it's all safe? There's nothing to see here. Why are food dyes treated like American citizens with due process rights and cloaked in the presumption of innocence until proven guilty? We treat pesticides and herbicides the same way. In the United States, we have to wait decades to prove beyond a reasonable doubt that an herbicide is toxic before any action is taken. Let's single out paraquat, the subject of House Bill 1135. Paraquat controls weeds and grasses. It is quick-acting, non-selective. It will kill green plant tissue on contact. It is also highly toxic. Even small amounts can be fatal to humans. It is banned in 70 countries around the globe, including China, where it's manufactured, and many European nations, but it is being used on our farms right here and contaminating our food. Despite both independent studies and studies at the NIH, industry-funded research dominates the data pool. Regenerative farming practices, such as planting cover crops, can actually cut down on the need to use these dangerous pesticides, and the Healthy Pennsylvania package aims to incentivize those practices. There is a path forward, and it starts from the ground up. It starts with all of us here today who demand that companies put people over profits. It starts with the companies being honest and transparent with the ingredients they are using. It starts with giving people the tools they need in order to make healthy choices for themselves. It starts with unmasking the illusion that we are even able to make healthy choices, but because we are constantly bombarded with all of these toxic ingredients. I want to show for a moment what we're calling the $1 trillion tree. And at the top, we have all of these various diseases: infertility, cancer, endocrine disruptor, hyperactivity, fatty liver disease, diabetes, obesity. And we're treating all of this. But down here at the root of all of this is metabolic dysfunction. And at the metabolic level, we are constantly being bombarded with toxic chemicals, environmental toxins, and poor nutrition traced back to ultra-processed foods and all these various food chemicals that have come into our system with no scrutiny whatsoever. So we're treating the top without spending any money down here at the root whatsoever. In fact, we're spending nearly $5 trillion on these branches on healthcare in this country, which is about $15,000 per person per year, nearly 20% of our GDP. Again, none of it's down here at the root. And despite all of that spending, we have some of the lowest health outcomes among industrialized nations. The fact is, our food is literally killing us, and we are here today to do something about it. I want to thank the many people that have showed up today, not only to testify at the hearing, but to support the various bills in this package. And I want to recognize that the Environmental Working Group is here. Consumer Reports has been very supportive. Food Fight USA, the Roetdale Institute, Center for Science in the Public Interest, Health Freedom Pennsylvania, Bill and Carmela Singer of Plant-Based Pittsburgh, Maha Moms Pittsburgh, Michael J. Fox Foundation, PA Coalition for Informed Consent, Center for Food Safety. As you can see, the list goes on, and we're thankful to our supporters. And I'm also very thankful to Representative Arvin Venit, who's going to say a few words about the package.
So, thank you. My name is Arvin Venit. I'm the state representative for the 30th Legislative District in Allegheny County. I want to thank my colleague and friend, Representative Mihalek, my other colleagues who are here, and most importantly, the family members and constituents who are here who are advocating on behalf of the Healthy PA package. I'm an emergency physician, and one of the embarrassments, actually, from being a physician and the only physician here in our legislature, is that my education on nutrition in medical school and in residency was slim to none. And what Representative Mihalek said is absolutely correct. We are learning more and more by the day about how our food supply has been corrupted and how we must take action legislatively for transparency and accountability related to what is in our food supply. And I'll add that my wife, as a pediatric liver and GI specialist and nutrition specialist, would recognize the trillion-dollar tree that you just posted about all the diseases that we are facing that have at its root poor nutrition and, frankly, the marketing power of big food that has unfortunately affected us at this point. So I'm proud to stand here in bipartisan partnership with Representative Mihalek and other colleagues to state that we must take action and that this cannot just be left to the federal level. And so I appreciate the opportunity to be here, and I will turn it back over to Representative Mihalek to introduce our next speaker.
Thank you. I'd like to introduce my co-captain on this package of bills, Representative Melissa Schustman.
Thank you. I'm Representative Melissa Schustman from Chester County. I just think it's time in Pennsylvania that we make it a little bit easier to feed our families. I'm starting to lose my eyesight, and these labels are getting denser and smaller, so please help. And that is part of the motivation for this package of bills is we're all trying to do our best for our families, and it's becoming increasingly harder to know what is healthy. So I want to speak a little bit more about paraquat, which is HB 1135, banning the pesticide called paraquat. So we're all exposed to all these, harmful chemical ingredients in our food supply. We also know that, there's microplastics out there as well. That's becoming a buzzword, and people are responding by not drinking out of plastic. But there is a portion of these chemicals that are left behind from pesticide use. And paraquat is part of the first generation of commercial pesticides developed in the 1950s. We have other alternatives, safer alternatives today. Like my colleague said, a small amount can be fatal, and it's been linked to Parkinson's disease and childhood leukemia. So 70 countries have banned this. The entire EU has banned it back in 2007. And yet more than 10 million pounds are being sprayed on American crops each year. These countries have found as safer alternatives. We have those same alternatives right here in Pennsylvania. So I think it's time that Pennsylvania bans paraquat. While federal pesticide law sets the floor, we believe it's time to set the ceiling for our Commonwealth and ban this harmful pesticide. And this will help families. I know my son really loved his raw vegetables, and now I'm looking back and thinking how much of the food that I was feeding my son was actually healthy. We have to have more transparency and make it clearer and easier to keep our families' bellies full and keep everyone healthy in the process. Thank you very much.
Thank you. I'd like to introduce Representative Stephanie Shalaba, who's been so passionate about these issues over the years, and I know she practices what she preaches. So, Stephanie.
Thank you. I'm State Representative Stephanie Shalaba, and I'm here today not as a lawyer, not as a policymaker, but as a mother. I have a 4-year-old son, and like many kids, he's energetic, curious, and has a wicked sweet tooth. He loves bright-colored snacks and cereals with cartoon characters on the box, foods that look fun, but often hide something very dangerous inside. I'm talking about artificial food dyes and preservatives that, with clever marketing and hurried lifestyles, create an artificial sense of comfort and familiarity. As a parent, I do everything that I can to give my child the best start in life. But no matter how carefully I read labels or research brands or make trips to multiple grocery stores, I find it nearly impossible to avoid products that are filled with synthetic dyes and preservatives like BHA. And what's worse, these additives are still legal, still unlabeled, and still ending up on the plates of our children. Scientific studies have linked artificial dyes to hyperactivity, attention issues, and behavioral problems in kids. Issues that I've seen firsthand when my child has eaten certain colored snacks. And BHA, it's been classified as reasonably anticipated to be a human carcinogen by the National Toxicology Program. That's not alarmist, it's science. And yet these chemicals are still allowed in our food. Why are companies permitted to sell products in Pennsylvania that have been reformulated in Europe without dyes, without BHA, because those countries simply don't allow them? Why are our children's health worth less? As a mother, I'm not asking for the impossible. I'm asking for honesty and accountability. I'm asking for warning labels on products that contain BHA, for a ban on artificial food dyes that other countries have already removed from their shelves. We deserve to know what we're feeding our families, and our children deserve food that doesn't come with a hidden cost to their health. This isn't about my family. It's not about just your family. It's about all of us. It's about making sure that the food on our shelves is as safe as we believe it to be. And this is not a partisan issue. This is an issue where we need to stand together and act as the party of parents. This is an exciting day. We're not talking just about poor nutrition. We're talking about poison. We need to unite, and I'm so happy that 40 of us so far have been able to do so, in large part to Representative Mihalek's crucial leadership on this role. It is the beginning of a bright future for our children, and I couldn't be happier to help roll out this healthy PA package.
I'd like to introduce Dr. Megan Grega from the Kellen Foundation.
Thank you. It's such an honor to be here today. I mean, as a family doc, I can kind of go along with what my ER physician colleague said. That trillion-dollar tree that Representative Mihalek showed us is all too common for us. And what we learned when I went to medical school back in the last century was very little about nutrition. However, we know now that the food we choose to eat and the beverages we drink are one of the most potent epigenetic levers that we have to manipulate that can either help improve or damage our long-term health and vitality. Ultra-processed foods increase our risk of morbidity and mortality through two different mechanisms. One is from the impact of the food itself, but also, just as importantly, it's from the loss of benefit from other more nutritious foods that the ultra-processed foods replace in our diet. Ultra-processed foods are ubiquitous in our environment, accounting for over 50% of the calories that adults consume, and for our children, it's over 67%. So just think about that for a moment. Over 2/3 of what our children are eating are ultra-processed foods that are very deficient in the nutrition that they need to grow into our healthy adults. We know that ultra-processed food consumption can increase our risk of heart disease, cancer, diabetes, and dementia. And data from the Framingham Offspring Study have shown that each daily serving of ultra-processed foods can increase our risk of cardiovascular mortality, so death, by 9%. So it is imperative that the Pennsylvanians, all of us, devise a collective solution to support making healthy food choices in our schools, in our workplaces, and in our communities. And that's what the Healthy PA package of legislation is all about. So let's start working on making the healthy choice the easy choice for all Pennsylvanians. Thank you very much.
Thank you. And finally, I'd like to introduce Scott Faber with the Environmental Working Group.
Great. Thank you, Representative Mihalek and Representative Schustman and all the other legislators here for your leadership. I'm Scott Faber. I'm with the Environmental Working Group. I also teach food and farm law at Georgetown University Law Center in Washington, D.C. As you can see, everyone agrees that our food should be nutritious. Everyone agrees that our food should be safe. No one thinks that the people who feed us should be at twice the risk of developing Parkinson's disease. But unfortunately, the majority of food that we eat and 2/3 of the foods we serve to our kids are ultra-processed foods that are not simply designed to be delicious, but are engineered to be literally irresistible, interfering with the signals that tell us that foods are highly rewarding and tell us that we should stop eating. Unfortunately, 99% of the food chemicals that have entered commerce since 2000 have not been reviewed by experts at the FDA, but have been reviewed for safety by the companies themselves, the companies that make food chemicals. Unfortunately, the same country and company that makes paraquat, China, and a Chinese-owned state enterprise, is prohibited from using paraquat in China because it's too toxic, but can still sell it to the people who feed us here in the United States. I've come up today from Washington, D.C., and let me tell you, help is not coming from Washington. The FDA and our other federal regulators are not coming to protect us, and that's why it's so important that states like Pennsylvania make sure that our kids are being offered healthy food in schools. That's why it's so important that we ban dyes from school foods and put a warning on foods containing BHA. That's why it's so important that we pass a law requiring food chemical companies to tell Pennsylvania's regulators when they're bringing a new chemical into commerce and to show their math. And that's why it's so important that Pennsylvania is taking action to ban paraquat. Thank you very much.
Thank you. Once again, I want to thank everybody who's here today supporting this package of bills, everyone this morning who testified before the Consumer Protection Committee on why these bills are so important, and again to the 40 bipartisan co-sponsors, my colleagues, thank you for your support and advocacy, and that would conclude the press conference unless there are any questions. Okay, thank you.